cataracts. That is, what causes humans to be at risk of coming down with this opacity of the lens. One, increasing age. From the age of 60 and above, there is a risk of having cataract. Two, heavy alcohol use. Drinking of alcohol causes one to be at risk of cataract. Smoking of cigarettes also poses one to be at risk of cataract. Having poorly controlled blood pressure, that is, people that are hypertensive but are not compliant with their antihypertensive drugs, are at risk of having cataract. People with previous eye injuries, probably they've had a trauma to the eye, something pierced the eye, there was bleeding, they're at risk of having cataract. If there is anyone in the family that has had cataract before, whether the mother, father, siblings, grandparents, it makes such individual prone to having cataract. Also, exposure to rays, whether from sun, X-rays, very bright lights, poses one to having cataract. Metabolic causes like diabetes, like I said, high blood sugar, this swelling on the neck that we call goiter, poses people to be at risk of having cataract. Also, radiotherapy from cancer is also a form of irradiation. It poses people to be at risk of having cataract. Now, what are the symptoms of cataract? How do people know that they have cataract? The first thing is that, we said that the lens of the eye is opaque. It is clear. It is thin and clear. When there is cataract, it becomes sort of cloudy. I have an image that shows that in the left eye of someone here, you see this cloudy appearance on the eye. That's what cataract looks like. It's very common. I'm sure would have seen it at some point or the other. So what are the symptoms people with cataracts can have? Now, the symptoms can vary based on the position of the cataract or how much of the lens the cataract has occupied, or even whether it is occupying one eye or the two eyes. Now, first symptom they'll have is difficulty in reading. They'll find it uneasy to read, especially small print, or even see things that are far away, read prints that are far from them, or even identify faces. It's usually difficult for people to also identify. People that have cataracts, they have difficulty in reading, difficulty in identifying faces. People that they are very familiar with, they find it difficult to distinguish who is who. Also, even watching television might be so difficult. They might have to move very close to the screen for them to see. Even when the light is bright, for example, there is a room that is well illuminated, the light is bright, they find it difficult to see in such a. Even daily activities like driving become so difficult because they are unable to see. Now, I forgot to mention something in the introductory aspect. The function of the lens of the eyes is to help us see images. After we see these images, there's a nerve, there's something like a wire in our eyes that we call a nerve. That's what helps us transfer these images to our brain, that the brain now helps us interpret that, okay, what I'm seeing is a bottle, or what I'm seeing is a car. So when this lens when this lens becomes cloudy, the image is not clear, the image becomes blurred. So we don't even have a clear image. The interpretation the brain gives of the image is usually not clear. And this is what cataract does. So for anyone with cataract, depending on the degree of the opacification, the person has difficulty in seeing. Now, how do we make diagnosis of cataract? Anyone who has cataract is advised to visit the hospital for a doctor to examine them. we would want to do an eye exam. I'm sure that at some point or the other, we've been to a hospital and we've seen this white box that doctors keep in their offices where there are different letters with various sizes written on them, starting from the biggest letter to the smallest one. You will be asked to read that chart for us to see how good your vision is, for us to assess your vision. So once we do this, we also do some other tests to know how well you can see. At times, we even pour an eye drop into your eyes to make your pupils bigger so you can see. We want to know how best you can see. Then also, we give you colors to identify, because cataract, I said it makes your vision blurred. At times, it makes people um have difficulty in identifying colors. The colors appears blurred or even faded to them. So want to also see how much it has affected the sight for us to know the type of treatment plan to offer. Now, please note that the mainstay treatment of cataract is usually surgery, but we've come in contact with some patients that decline surgery. So there are other ways it can be managed, but the mainstay of treatment is surgery. So if you're uninterested, so surgery is usually recommended when cataract prevents you from going about your daily activities. When it's getting so bad that one can't even see, when you're for example, you're in your sitting room, there is light, but you can't even move around. You don't know where to go to. You want to pick something, you have to really strain to pick things. You can't even drive your car. You can't drive to work. You're unable to even read the newspaper or go through your phone. Then it's beginning to affect your daily activities. We always want to intervene surgically. Now, technology has helped us find ways that are less invasive. When I say less invasive, that is, we don't have to go necessarily start using knives to cut through to see. Technology has helped us with something that appears like an ultrasound. This would release waves that will help to break this lens apart so that these opaque pieces would be removed. I'm with you, ma.
Okay, please go ahead. We can't hear you. Please go ahead.
Okay. Thank you, ma. Okay, thank you, ma. So the ultrasound helps to lyse the opaque lens so that we just take it out. This procedure is not invasive. It's a daily procedure, that is, you can just come to the hospital that morning, the procedure is done, and you go home after the procedure. Now, another form of surgery is when we actually have to go in to scrape out or remove that lens that has been clouded. We take it out, and there's an artificial lens that would use to replace the affected lens. That one, of course, the patient will need to be admitted for a few days, after which the patient goes home. But please, I want you to note that surgery to remove cataract, whether the one that requires ultrasound or the one that actually is invasive, it's actually very safe, and the success rate is very high. Although every surgery has its own risk. There's a risk of infection, there's a risk of bleeding, there's a risk of there's some risk of other complications I wouldn't want to bore you with, which can occur in any type of surgery, regardless of how minor it is. But that of cataract, the chances of having complications in cataract is less than 1%, as studies have shown that most people that have cataract surgery go home the same day as their surgery. So cataract surgery is generally considered to be very safe. Please, cataracts can interfere with your daily activities and can cause complete blindness if left untreated. This is the reason why it is best to seek care. Okay. So, talking about the prevention of cataract, prevention helps you to reduce the risk of coming down with cataract. So, how can we prevent it? Now, we can prevent cataract by avoiding all the risk factors I mentioned earlier. Cessation of smoking or taking alcohol, protect eyes from rays. That is, you put on, whenever you're going under the sun, please put on protective shades. Also, reduce your exposure to radiation as much as you can. That's why doctors always counsel patients that you cannot carry out X-ray frequently, at least at an interval of 6 months or even 1 year. Also, please, you have to maintain a healthy weight and diet. That's the best way to prevent diabetes. And if peradventure you're diabetic, please monitor your blood sugar regularly. If you're hypertensive, please monitor your blood pressure regularly. That is, if you're on medications, please take those medications religiously. And also keep up with your follow-up visits in the hospital. Most importantly, you have to come to the hospital regularly for eye exams. If you notice any discoloration, any whitish discoloration of your eye, or you notice that you have difficulty in reading, seeing faces, or carrying out any of your daily activities, please don't hesitate to visit the ophthalmologist for further evaluation. So this is just what this indication for treatment just tells us about the what we use to grade the level of care that is needed for various degrees of cataract. If the size of the cataract is greater than 3 millimeter in size, if it is located on the pupils, or it is already becoming, or it is beginning to cause further complications, most likely it will need to be surgically taken out. The next image is just showing us the chart I spoke about, which I believe most of us would have seen, that we used to carry out examination of the eyes. Also, when you visit the hospital, like we discussed earlier, some comorbidities, that is, some other illnesses that one might have can predispose one to having cataract. So it's not just the eye your doctor wants to examine. Doctor wants to check your heart just in case you're hypertensive, wants to send you for an ECG. There are some other tests the doctor will want to do, just so we'll know what is posing you to be at risk of having cataract. Now, in case the person will require surgery, there are some patients that will need cataract surgery that we might have to put to sleep. Now, that would depend on your doctor's what your doctor sees after you've been evaluated. If the person is a child, or the person has a lot of comorbidities, maybe the person has a blood pressure that is not well controlled, blood sugar that is not well controlled, or the cataract is affecting both eyes and will need to be taken out, or it's even in a child, most times we need to put such person at sleep for the surgery. But if any of these factors I mentioned are not found in such patients, the patients can be awake while the surgery is being done. And there's an image that is just showing where we give the injection. Now, for patients that do not want any form of surgery, whether the ultrasound or the surgical removal itself, there are other things we can do for such patients. We can give you a recommended glasses that will help you see more clearly. It will also be a photochromic lens, so that even when you are under the sun, where there's lots of light, it will protect your eyes from the light. Also, we can give you some eye drops that would be of help. In some instances, you can even give contact lenses, but this will still be with the discretion of your doctor, if that is what would be best for you. Thank you so much. That's the end of the slide. Thank you for listening.
Thank you so much. Thank you. Before we come up with our questions, let me quickly go to the recap. The topic once again is cataract, and the doctor has already made us to understand that Even at birth, a child can have cataract. After birth, then the age. Then she also talked about people that are prone to cataract, people that have diabetic, people that have goiter, and people that have injury on their eyes, and people that do heavy alcohol, people that drink a lot. And she also advised us she also mentioned about the symptoms of cataract. She said they will be unable to read, even unable to see, and if care is not taken, if surgery or other treatment is not applied immediately, it can lead to somebody losing one or two eyes. So she also talked about how we can avoid it. She said we should try as much as possible not to be going for X-ray frequently, putting on our sunglasses. Then we should maintain a wealthy weight and good diet. She also mentioned that people that have diabetics, they should try as much as possible to manage their sugar level and take their medication regularly. And for those that do not have diabetics, they should try as much as possible to monitor and manage their sugar level. And the beauty of it is that cataract surgery is not the end of one's life. According to her, she said people can go for surgery and leave the hospital premises and they can be discharged at the same day. So if anybody is suffering from it, please don't be afraid. Delay might be so dangerous. Don't be afraid. Try as much as possible to speak with your doctor. And if there's any need for you to undergo any surgery, please don't hesitate to do so. So once again, I will say thank you to our doctor. We are so sorry the screen does not come up. We don't know the reason why, but we send it to our different platform where we can see it. So on this note, if you have anybody have one question or the other, you can write it or you can indicate by raising up your hand. So it's question and answer time. Thank you. Any question? Okay. Doctor, please, somebody ask, is it good to be putting, it said, there was a time that they said it's good to be putting breast milk in somebody's eyes for more clarity. How far is true? Is that true?
Okay,
Doctor, can you hear
thank you,
me?
ma.
Okay, putting of breast milk in
I
somebody's
can hear
eyes.
you, ma. Okay, thank you for the question, ma. Please, it is not advised to put anything in anyone's eyes, clarity, whether breast milk, cow urine, and some other things. Please, those things cause more harm than good. If you have any complaints as regards your eye, it's best to visit your doctor. Can you hear me, ma?
Yes, yes,
Okay. Have I answered the person's question, ma?
yes, yes. Okay,
Okay,
somebody asked
thank you.
another question here. On the case of the two eyes affected, for how long can we wait for the other surgery? Maybe one eye has been operated. For how long can the other eye
Okay.
be operated on?
Okay. So usually, in some facilities, in most facilities, we can do it at an interval of 48 hours. So we do one eye today, 2 days after we can do the second eye because it heals really quick. It's not
Okay,
a it's not sort of a major procedure. It's used provided there were no complications. Within 48 hours of doing the first procedure, we can do the second one.
Okay. Another question. How long does it take for cataract to progress to the other part, other eyes, before causing blindness?
Okay, thank you for this question, ma'am. So the truth is that there is really no time frame. The rate at which the cataract can progress varies across each human. Are you with me, ma?
Yes, go ahead. We can hear you.
Yeah, so the rate at which the symptom can progress varies across each human. The only way we can know is that when the symptoms the patient is having, for example, before I can move around my sitting room, suddenly I wake up, I'm not even able to identify anywhere. It is gradually getting worse. And we know glaucoma is usually it's more of a silent disease. It doesn't really show symptoms until late stage. So there is really no time frame. That's why it's best that once there is a symptom, quickly visit the hospital before your symptom worsens.
Okay. Another question.
Thank you.
Can cataract lead to glaucoma?
Yes, please. A common complication of untreated cataract is usually glaucoma. And we know that glaucoma, once there is glaucoma, we are only just going to stop the progression. Whatever damage that glaucoma has caused cannot be reversed. We can only stop it from getting worse. That is why we always tell people to come to the hospital early enough before it becomes glaucoma.
Okay.
Thank you.
Another question. Can using of glasses for sighting and reading prevent cataract?
That's a very good question. Yes, please. Provided that your lens is a protective one that protects your eyes from sun or from bright light, it can help you reduce the chances of coming down with cataract.
Okay.
It is one of the ways of preventing yourself from coming down with cataract. And it's not only the eyes we spoke about, other measures we're also spoken about. So this is also telling us and trying to encourage us to pay attention to our general body as a whole, because just one disease can also be related to various diseases as you're protecting your eyes, monitor your blood pressure, monitor your blood sugar also. Thank you.
Okay. Another question is that can cataract spread from one eye to the other? Then can it return after surgery? Can cataract return after surgery?
I didn't hear the first part of the question, ma. Can
The
cataract
first
what,
one
ma?
is, can it spread from one eye to the other?
Oh, okay. So cataract is not contagious. Let us have that in mind, ma. Cataract is not contagious. It is not spreading from one eye to the other. It is just that having it in one eye can increase your chances of having it in the other eye, but it is not spreading. Do we understand, ma?
Okay. Okay.
Just the same way it cannot spread from person to person, but having it in one eye is putting you at risk of having it in the other eye. But you having it in one eye does not mean it can spread to the other eyes. So the second question, please, ma.
Okay. Can cataract return after surgery? Can it reoccur?
Okay, thank you very much. So yes, um, the chances of cataract returning after surgery is very slim. Why did I say this? Because it can return after surgery, yes, but the chances are very slim. I mean, there are very, very, very few patients that have reported a case of cataract after surgery. And this is because majority of them were due to the metabolic issues I mentioned before. For example, a patient that is diabetic with the blood sugar not being controlled. Even if I take out the cataract, what is causing the cataract is still there. So after surgery, there's a very high chance it will occur. But if the patient is very fine, the chances of it returning after surgery is very slim. Very, very slim. Less than 0.5% chance. Thank you.
Okay, thank you. Please, okay, somebody
You're
said,
welcome, ma'am.
I was told that my eyes are dry and will need to buy a medication
I
to.
can't hear you clearly, ma'am.
Okay, I have another question here. Is it obligatory
Okay,
to
ma'am.
be using glasses permanently after the surgery has been done?
Okay. Um, based on the your physician, based on your physician's discretion, depending on the examination findings your physician gets, it is advisable to use a protective shade after the surgery. For example, if yours was maybe due to exposure to light sources, yes, you should always wear protective shade when you're going under the sun. Not necessarily to always walk around. Okay, I'm going under the sun, I'm using my protective shade. If I'm back home, I don't necessarily have to. So you don't always have to wear it around. You're just wearing it to reduce your exposure to what can make you come down with cataract.
Okay, somebody said, I was told that my eyes are dry and will need to buy any medication to improve it. What could be the cause and how true is the statement? A physician told her, and according to him, he said he didn't believe. He said they
Okay.
said his
Thank you for
eyes are dry and was asked to buy medication to improve it. He's now asking what could be the cause of that statement. Doctor, can you hear the question?
okay.
Hello?
So please, I would have loved to ask the patient if the patient was thoroughly examined by a physician and the exact explanation the patient was given. I don't think any physician would tell anyone that the eyes are very dry and there is a medication that should be needed, except if there were some explanations that was not well communicated. I would advise such person to actually see a doctor again for better explanation
Okay. Another question
before
here.
getting the medication.
Can cataract cause severe headaches once a while and glaucoma not confirmed?
Hello, ma. I can't hear you clearly, ma.
Can cataract cause severe headache once in a while?
I'm sorry, I didn't hear you clearly, ma.
Can cataract cause severe headache? Can you hear me now?
Oh, okay. Thank
Uh-huh.
you, ma. Yes, I can. I did. So please, if you notice you have cataract and you're beginning to have severe headache, there is a possibility that you have some degree of glaucoma, which is a complication of cataract. Please and please try to see your eye doctor as soon as you can, because cataracts will not be what would cause the headache. Glaucoma most likely is what is giving you the headache. So you need to see your eye doctor on time for further evaluation, please. Thank you, ma.
Okay, thank you so much. I believe you done justice to our questions this morning. So on this note, I
Hello,
would
ma.
like to, hello. I would like to recognize the presence of retired permanent secretaries that are on this call. I can see Mrs. Adelaja Abosede. Good morning, ma. Thank you for joining us this morning. All our retired directors that are on this call, thank you so much for joining us, and all the serving officers. Thank you for taking out your time to join us this morning. I believe we've learned a lot about this topic, cataract. So please, let's try as much as possible to see a doctor. Please, like what our facilitator said this morning, don't put any kind of milk in your eyes. no cow urine, no salt. Don't put anything in your hand. Please try as much as possible to see your doctor and let us live healthy and eat balanced diet. So on this note, I would like one of us to please raise his or her hand up to appreciate her doctor. Please, any volunteer among us to appreciate our facilitator this morning? Anybody in the house? Okay. So I didn't see any hands up. So I would like to appreciate our doctor this morning for this for doing justice on this topic. And I personally have learned 2 or 3 things about cataract, and I believe we've learned also. So I would like to say thank you, doctor, for this presentation. And somebody said, ask about your contact. I can't give your contact now. I need to discuss it with my director. And if she gives me the go ahead, we send it on the platform for the person to see. So thank you so much. God bless you.
Thank you,
And
thank you
many
so
that
much.
need our contact,
Amen.
you will see it on the YouTube. We see it on the YouTube. The section is live streamed on the YouTube, so you can go over and watch it and get whatever information that you need. So thank you so much. So on this note, I would like to invite. I would like to invite. Okay, people are thanking you via message, appreciating you for the section. So I would like to invite Mrs. Adelaja Abosede to please declare the webinar closed for today before we do the normal greeting. Please, Mrs. Adelaja Abosede. Everybody, on behalf of the head of service, Mr. Agoro, and the permanent secretary, Mrs. Sukomi Oyebola, the director of post-service department, Mrs. Bukola Durodola. I'd like to say thank you for taking your time. Thank you for joining us this morning. We really appreciate you. God bless you all. So in next 2 weeks, by the grace of God, we'll be discussing about business, and other topic related to finance by the grace of God. So see you then. Stay blessed, stay safe, and live healthy. Thank you and God bless. So on this note, let us do a normal thing. Let us all unmute and greet ourselves. Good morning, happy new month. So let us go ahead and unmute ourselves. Okay. Let us greet ourselves.
Good morning, everybody. Thank you very much, the facilitator.
Good morning. Thank you
Good
for
morning, everybody. Thanks for that.
Everybody, thank you for the facilitator.
all healthy.
Good
Joining us.
Good morning.
Bless you.
Good
Morning,
morning.
Director.
Thanks for this
Appreciate
loaded information.
you.
Mrs.
Thank
Kolawole,
morning. How are
Education
you?
District 2 retired
Well,
principal. Good
Mrs.
morning,
God
Adeba,
Mrs.
bless you.
Durodola.
this is Mrs.
Good morning,
Asune.
the
Thank you,
HOS. You
Mrs.
How
are
are
Oye.
well
you?
appreciated.
Thank you for
All
joining
of this, God bless you. We all live long in Jesus' name.
from
We all live.
Abuja. Thank you so much for joining us.
This is a good one. Thank you very much.
Mrs. Jubri, how are you? Thank you.
Oh,
Thank
Mrs.
you for
Patola,
job well
thank you
done.
for joining us, ma'am. Thank you so much. Really appreciate you. Thank you. God bless you.
God bless you. Well,
thank you, ma'am.
Good morning.
Good morning, ma'am.
Bye.
I want to say thank you to you. God will continue to strengthen you.
Amen. Okay. On this note, I would like to end this money webinar. We still have time. This is past 11, but I believe we've learned a lot. So I will draw the curtain for this money program. See you next 2 weeks by the grace of God. Bye-bye. Have a beautiful day. Stay blessed.